Hello and welcome to the EduTalk series hosted by Biotone EduPartner School Program, and massage industry experts. With the growing interest and popularity of the EduTalk series, Biotone continues to support virtual learning and building massage community by connecting you with industry experts who share their knowledge and expertise on topics not only for class discussion, but career success. Today's expert is Michael Morgan, who is renowned for his application of Upledger CranioSacral Therapy in the evaluation, treatment, and support of the adult population suffering from dementia and Alzheimer's disease. Michael's clinical experience has paved the way for cutting-edge solutions, merging bodywork into the field of dementia and Alzheimer's treatment. Let's listen and learn as Michael shares his 15 to 20 years of groundbreaking research on craniosacral therapy for Alzheimer's and dementia. His non-pharmaceutical approach offers hope in a bleak landscape. Michael will take us on a deep dive this evening into this important manual therapy as a window into the future of treatment for these conditions. Again, thank you everyone for joining us. Thank you, Michael. I know you have a lot to cover, so I'm exiting the screen and I will be back to help with chats at the end of your presentation. It's all you.
Very good. Thank you, Donnell. Thank you so much for having me, and thanks, Biotone, for hosting this series. And I think this is very valuable for all of you, all of the therapists, to find out even more about how things are working in this world. So it's a great pleasure to share with you this afternoon. Basically, in this little talk, I'm going to cover three things. I'm going to cover the why it's important to work with the senior population, and how it works, the mechanics of how craniosacral therapy especially relates to memory and cognitive problems in Alzheimer's dementia. And then finally give you some resources for your further education if you're kind of compelled to work in this area and are drawn to it. So what I'm going to do right now is go to my screen share and just take a second here. Everyone can tell me, Janelle and all the coordinators, how I'm doing with that. And I'm going to set things up in just a moment here. Whoops, here's my comment. Okay. Give me just a moment. Okay, slideshow. Okay, everyone gives me a heads up here if they can see the full screen. I'm going to assume they can. So yeah, so I call this talk the role of craniosacral therapy in addressing Alzheimer's dementia. And as Donnell said, as I go through this, you can put questions in the chat, and then I'll answer your questions at the end of the presentation, and really welcome any and all input with this. So the first thing I want to talk about is the changing demographics, which may be obvious and maybe not. In the world, because we live on a planet where there's an aging population on the rise. Over 1.5 billion people are over 65 years of age, and by 2030, 1 in 5 Americans will be this age or over. And also by 2030, for the first time in history, the number of seniors will outnumber the children in our society in the US. So the why for addressing the 55 plus population and older. And I'm going to talk about what I call the pyramid of aging. And even though we have been speaking about this to years, I like to acknowledge one of the speakers at American Society of Aging that I spoke at, I've been speaking at for years, Bradley Sherman, for his insights and comments on the subject. So here's the pyramid, all right? And this has been for the last 2,000 years. I don't know if you can see my little pointer or not. But this little man at the top is the senior population. That's typically the age distribution for the last 2,000 years. The younger people are at the bottom, and as you advance in age, they're in a relative minority. That's the way it's just been traditionally in terms of aging. However, this is changing. Now, over the next 15 years, globally, the number of people that are older, middle age, and younger will be about the same. And then as we go on, the baby boomer generation, as we call it in the US, there are 70 million plus baby boomers. And people that are 50 years or over in the US is about 100 million. So that's like a third of the population. So that's significant. Notice then at the bottom, the younger people are getting to be more at the bottom of the pyramid. The pyramid is essentially kind of upside down. And so to give you a perspective on the fastest aging populations in the world, which in a way reflects industrialized countries around the world, is that China is one of the fastest aging populations in the world. They made a bit of a mistake about 30, 40 years ago in their management. And they, created a policy where there was one child per family, and it turned out to be much more boys than girls. And now, because of that miscalculation, they were afraid they were going to end up with 4 billion people by the end of this century. Well, that didn't happen. But what happened is that because there's an disproportional amount of people that are aging, it's actually now one of the more populations that are starting to age more quickly. And that's followed by Korea. And then that is followed by Japan, where basically by this year, about a third of the population will be 65 years or over. And I've done some presentations that have been translated by Facebook into Japanese about technology and ancestry and how we honor that area. Just a little bit of an aside. And then Italy, post-World War II. And then finally, Spain. So those are all areas with some of the fastest aging populations in the world. And then the US, as a function of the percentage, it's going to be about a third of that population. So it's kind of interesting to get a view of that. One of the youngest populations is actually around Kenya and in Africa as well. So that's interesting. It's a measure of birth rate, okay, and replacement measure of birth rate. All right, so another piece to give you an idea and perspective is what I call the pyramid of inflammation. Sometimes Alzheimer's, or rather aging, is called infla-aging because there's so much inflammation. And my mentor, Dr. John Upledger, I'll say more about in a minute, really kind of pioneered this idea before it became a very popular subject. So in this pyramid, you can say that diet and pre-existing conditions are about 200 to 250 million people. Diabetes and pre-diabetes is anywhere from 20 million people with diabetes to about 80 million pre-diabetics. Cardiovascular disease is 20 million. And Alzheimer's and dementia is at the tip of the iceberg. That's about 5 million people, 5.2 million, really pushing 6. And that demographic is expected to triple in the next 30 years. So I just kind of call this the pyramid of inflammation. And even though our focus is on aging, as you go down in the pyramid towards the base, you're also getting to a younger population. And what's happening is that, as we go from people that are possibly 60, 65 or over in this area of Alzheimer's dementia, cardiovascular and others, then we start to bridge into the 50s and even into the 40s and the 30s. So you can see the potential of people hurtling towards this pyramid as we go forward in time. All right. So the disease process in the pyramid of aging, what happens when this is flipped on its head? So as I mentioned, there's over 50 million people now in the US. That's about a third of the population. There's 440 baby boomers, so to speak, in China out of 1 billion people. And again, about 33% of the Japan population will be over 65. I wrote this particular slide a year ago, so now it's upon us, 2024. So again, looking at this pyramid of population, you can see how this pyramid is kind of flipped on its head. And so this is just a slide I thought I would mention because I talk a little bit about the demographics and what has happened to our senior population. In the 1950s, a lot of the population was still in the workplace, but they really encouraged people to retire because the baby boomers needed jobs, and they, encouraged people to retire. And so now in the 1990s, only about 14% of people in the workforce are in this demographic and still working. And that's a reflection of age and experience. And then we talk a little bit more. This is a whole nother webinar. I talk about isolation versus inclusion, senior communities over 55, which actually is found out is not as popular as people think. Senior living is not the first choice. And aging in place, as it's called, is a preferred alternative, which can relate to you as therapists. Like, why is it important to serve this aging in place population? All right, so that's a little bit about the background. So you can see the why. It's great to work on middle-aged people, even younger people, even babies and kids. But when you have a third of the population in this age group, that's pretty significant, not only as a career opportunity, but as a real social need. All right, so the mechanics of craniosacral therapy in relation to memory and cognition. Alzheimer's, as in these Alzheimer's World Summits that I'll do, I'll mention more about that at the end. And I interview people like Dr. Dale Bredesen, another expert in Alzheimer's dementia. Alzheimer's is not a one-pill solution. This is why no pharmaceuticals have been developed that covers the whole thing. It's a tremendous opportunity for drug companies who have invested billions of dollars in this. But unfortunately, the way that pharmaceuticals work, it's like one factor connects with one molecule. And I'm sure most of you have cell phones. So here's the analogy. If you take a cell phone and hold it up and you hit that little button, sometimes you do it, not automatically, but it just accidentally. And all the apps kind of squiggle. What happens when you take one app? All the other apps switch around, right? That's kind of like what happens with pharmaceuticals, is that you're targeting one molecule to get one effect, but in relation to that, all the other factors, intended or not, may react. So that's why you get side effects. Just a little primer on that really quick. So what can happen with Alzheimer's, which is why we call it, it's not a one-pill solution. There are 5 basic factors that contribute to Alzheimer's, okay? One is inflammation, and that can have a lot to do with diet. Not all, but very much about diet. If somebody's been eating carbohydrates and sugars that can be toxic to the gut and the immune system and the nervous system over decades, that can cause inflammation. All right, so that's one factor. Atoxic, meaning hormonal, which is a newer area of interest, especially postmenopausal. Like, what is the effect of hormonal imbalances? That's a whole new area that we're starting to look at and research in that area. Toxic, as in heavy metals, like mercury, aluminum, lead, any number of things like that, okay? Vascular, as in stroke and heart attack. And then trauma, as in closed head injury. We've worked a lot with NFL football players. What's the trauma and impact on the head? So given those factors, it may be in any one person that comes up with a diagnosis, quote unquote, of Alzheimer's dementia. Half of it could be inflammation, 30% of it could be toxic, 20% of it can be trauma, or any combination thereof. It might be 10% inflammation and 50, 60% atoxic, and the rest, any combination of factors. So that's why using your hands to palpate and having the skill to dialogue with the soma of the body, and of course there could be an emotional component too. These are all factors that add together. And of course in craniosacral, we'll talk about this more at the end, there could be an emotional component as well. So these are all factors, which it kind of explains why one size doesn't fit all. That's why anyone with a diagnosis really deserves more of a consultation to really evaluate where these factors are coming from. So I hope that's useful to kind of give you shed some light on that. All right, now, for those of you that are not familiar, my mentor, Dr. John Upledger, discovered, so to speak, and documented the existence of a craniosacral system that conducts cerebrospinal fluid in the head and down the spine to the sacrum. So often when people think about craniosacral, they think, oh, it's just a head thing. But actually, it's the head, it's the sacrum, and it's the dural tube or a membrane that connects with the spinal column in between. So all of this together, the head, the spinal column, and the sacrum, is called the craniosacral system. And Dr. Upledger really discovered that in palpating the craniosacral system, which is a bit more subtle than listening with other ways to the body, actually the whole craniosacral system underlies the neuroskeletal muscular system. So if we listen to the body in pattern within the body, is often a lot of the memories of trauma or whatever has been in the body for decades. And with our hands, we can discover that. So that's a little bit of a background on craniosacral therapy and how this works. Now, another thing as far as basic definitions, there's something called the lymphatic system. And I'm going to play a little bit of a tape from University of Rochester in a minute. There has been a discovery in the last 10 years, and the discovery is the existence of the lymphatic system. All right. Glymph means glue, and lymphatic means lymphatic system, but this is the lymphatic system inside the head. And it was thought it was existed, but until researchers at the University of Rochester and University of Copenhagen were able to develop this photon imaging, it's called, to look at these fine structures in the head, they couldn't really validate the existence of this structure officially. They knew something was going on, but they didn't have a view literally into the mechanics. And so part of how this lymphatic system is structured is that it's made up of about 100 billion neurons, which has been the major area of research in neurology for the last 100 years. That's what everyone studied is neurons. But also it's composed of about 100 billion astrocytes, or glial cells, and about 1,000 kilometers or 400 miles of capillary structure. So as you can imagine, this is a very fine and delicate structure. But this is the structure that conducts, if you see this light blue, cerebral spinal fluid that we study primarily with craniosacral therapy. But we can follow conduction pathways down into basically every nook and cranny of the brain, from the periphery underneath the head all the way down to the deep structure underneath. And more about that in a minute, like why that's important. All right. Now, craniosacral therapy is, again, it's a gentle, non-invasive manual therapy that connects deeply with the central nervous system and the flow of cerebrospinal fluid. And what I've been saying for some time now is that we deem craniosacral therapy to be the missing piece in addressing Alzheimer's and dementia. And what I mean by that is that there's been a lot of focus on diet, understandably, and exercise, other modalities, but part of my campaign, so to speak, in educating neurologists, doctors, physical therapists, occupational therapists, acupuncturists, and others is to say, if you don't address in a gentle way the manual therapy, you're not getting to the structures deep inside the brain, which allows nutrition to go in and really do its work, as well as any pharmaceuticals that might be deemed effective as well. You need to really focus on the microstructures in the brain in a very subtle and safe way. All right, so look at this little illustration. Look over here on the right, and this is a little bit of a YouTube video of the flow of cerebrospinal fluid. Do you see that? Looks like radiator fluid. Look at that flow surrounding all the periphery of the brain. I'm going to show this again. But what we found is that CST, craniosacral therapy, helps increase the flow of cerebrospinal fluid in the brain, which helps to remove toxins and unwanted proteins, including amyloid plaque. CST also reduces neuroinflammation from the brain and other parts of the central nervous system, identified as the leading contributing factor in memory and cognitive problems. So just take another look here on the screen on the right. And as I play this, here's the choroid plexus where CSF is manufactured. Here's the lateral ventricles. See it spread down, surround the lower brain, the cerebellum, and then that comes up and surrounds the periphery of the brain. So this is something that's been studied for the last 3 to 4 decades quite extensively in craniosacral therapy. And the idea of many theories about how there's a pumping action in the brain and the body which circulates this CSF, but you kind of get an idea of that little core, okay? And we'll dive deeper into this in a minute. All right, so CST also has an integrative and supportive function, as I mentioned. It helps to enhance the effectiveness of almost all the approaches I'll discuss in the next few slides. So it's complementary to diet and to sleep, where in this lymphatic system, during sleep, about 40% of the work is done draining toxins from the brain. So sleep is very important. You can see and infer the problem if sleep is interrupted or not as effective. Metallic toxins, like I said, like mercury, aluminum, lead, and a host of other things. Mold and Lyme disease is another thing that's becoming a factor because it impacts the immune system. Concussions and external head trauma, and then even holistic dentistry in the sense that the mouth itself is yet another entree for problems to affect the brain. So, and I've interviewed quite a number of holistic dentists just to talk about those factors as well. So I mentioned infla-aging, and even though our focus is on memory and cognitive function, there's a number of interrelated symptoms, many of which are inflammatory in nature. And I kind of call all these in general, generically, the diseases of aging, which can precede Alzheimer's and dementia by decades. That's why Alzheimer's dementia isn't just something you wake up with like you have the flu, but it's something that probably has been building, and there's lots of precursors as you look back further into someone's history to find out, okay, what's been going on to really get to this point and to get to this diagnosis. So the diseases of aging include diabetes. Over 100 million people, or about 20 million people are diabetic. Again, about 80 million are pre-diabetic. So that's 100 million in all. That's a lot of people. That's as many people as there are over 50. Cardiac disease, cancer, osteoporosis, joint stiffness, digestive problems, arthritis. Notice the ITIS at the end. That means inflammation. Autoimmune disorders, Alzheimer's, dementia, and most of which are inflammatory in nature. So that's a key as well. So how does CSF combat this in ways we already know from our therapeutic experience? It can help increase the volume of cerebrospinal fluid flow. It can help enhance immune and endocrine system dysfunction. It can help increase overall connective tissue fluid flow in the body. It can assist with neurological balance. It can assist with somato-emotional release and release of emotional trauma. It can help really with completion of the past. All right, so more on this mechanism of memory loss and cognition. All right, using these techniques, techniques, our focus on these issues common to the aging population. There are certain issues that are very much common in what we call an Ayurveda Vata disorders, when there's a drying of the system, especially after like age 59, 69. A very common thing with older folks is there can be bone challenges like osteoporosis or bone weakness, vision, hearing imbalance, immune system challenges, thoracic, like in the heart and lungs, digestive, and cognition and memory. These are some of the crowd pleasers, so to speak, with the aging populations. These are common things that that come up with this population. All right. Now, the question of memory, Alzheimer's, and dementia. You've kind of seen this chart before. What can happen is that there's a structure in the brain called amyloid plaque, which can form and become problematic. And often it can be found starting both in the hippocampus and the central brain, but in the prefrontal cortex. They're called amyloid plaques and neurofibrillary tangles, all right? And it turns out that over decades, one or more of these diseases of aging can overflow and show themselves in the brain. Now, what I'm going to do for just a second is go off script, and I'm going to do a little audience participation, all right? Because I think we have time to do this. So I'm going to stop share for just a moment. All right. What I want you to do, imagine that you're, and I'm going to put myself on spotlight for everyone to do this. Take a piece of paper, and in this piece of paper, make a vertical line on the left and one on the right, and then make a horizontal line, just like a goalpost. I don't know if you can see this very well, but let me, allow me to play with this. And then make some hash marks, maybe about 20 hash marks, and label on the left begin and on the right end. You can see this. Hopefully you can see this. This is the way to explain what happens in the arc or the trajectory of Alzheimer's. So a lot of people you hear about talk about early, middle, and late stage Alzheimer's, right? There's something called MCI or mild cognitive decline. If you make a look in your little hash marks, and pardon me for my scribbles, you can put late, mid, and early, and maybe MCI, and then after another hash mark, asymptomatic. And pardon my spelling here. Those are basically the scribbles. So every 2 years from the end, close to the end, all the way back. So it means that maybe by the time we see symptoms, we're already in a 20-year span, maybe 15 years down the line or more. And so one can ask, well, what's been going on prior to that for the last, 10 years before that or before? It's probably one of these ages of diseases, that have been building. So when I explain this to people, why there's a sense of urgency by the time somebody gets a diagnosis or feels like something's going on, there's already quite a few things that have already been building, if that makes sense. All right. So I'm going to come back to my PowerPoint talk and go back to screen share. Get this back again. Takes a second to filter through. And all right, so we're back to our screen. Anyway, that's a little aside, but I wanted to give you a sense of, okay, this is what's going on in the structure of the body when this happens, the diseases of aging. All right. So working backwards, you can see how memory challenges are built on the platform of prior insult, injury, and inflammation. So our proposed etiologic model for the Alzheimer's, formation. Etiology is the study of causes, like what's actually really causing. And the idea in our model that we've been talking with therapists and scientists about for some years is that the flow of CSF, cerebral spinal fluid, in the brain is significantly correlated with the progression of Alzheimer's disease, and inflammation in the brain also contributes to this decreased flow of CSF. And the analogy that when I gave a TED Talk years ago that I used, it's like a river that's flowing well and freely. And maybe the water table starts to decrease and there's less flow of water. And then the water basically starts to decrease. The water table lowers. By analogy, the average healthy adult produces up to 800 milliliters, 600 to 800 milliliters of cerebral spinal fluid per day. But in severe Alzheimer's, this flow of cerebrospinal fluid can be 75% less. So it's like a river that dries up and all the mud and sludge and silt gunk up. That's analogous to these amyloid plaques and neurofibrillary tangles forming. And so here is, for example, on the left, a healthy brain, and one with advanced Alzheimer's is like somebody shrunk the brain, right? And the brain literally starts to dry up. Most doctors, without even knowing about this, understand there's brain shrinkage. That's what happened to my sister-in-law, one of the people that, and my stepmother too, that got me kind of involved because they died of Alzheimer's, you know, well, like what happened? So you can see how the brain literally shrinks. And unfortunately, you just can't put like moisturizer on your bald head and have it sink into the brain, only if we could. But you need something else to get right deep into the structure of the brain to help increase this flow. And I think I'm going to play a video now. So Danelle, let me know that this is playing okay. This is a video from University of Rochester. Oh, sorry. Here before that is just another example of this flow of cerebrospinal fluid. This time, I'm adding to it how this lymphatic system, wait for it, and you'll see a flow of the blue right there. That's that flow of cerebrospinal fluid on the periphery, but then it's penetrating deep into every deep structure of the brain itself. All right. All right, and again, we're referencing this lymphatic system network where there's a periphery of flow of cerebrospinal fluid, and then there are structures called aquaforins which conduct this cerebrospinal fluid into what's called extracellular fluid and conduct this deep into every basically nook and cranny of the brain. Now, watch this video. It's a 3-minute long video. Let me know if you can hear it okay. We tested it. And here we go.
The brain is highly metabolically active. The brain cares an awful lot about what its environment is like. If it's off just a little tiny bit, it stops functioning properly. We showed that the CSF goes into the brain just like people thought before, but it actually does so along very specific anatomical structures. There's a specialized anatomy that allows the CSF to move very quickly and very deep into the brain, exchanging with the fluid that's inside the brain and then moving out. So it's a much more efficient system for clearing the fluid and the waste out of the brain. We injected fluorescent tracer into the CSF, or the fluid that surrounds the brain, and watched to see where it went. The fluid, as it moves down the artery, is able to move right into the brain tissue. As it moves into the brain tissue, eventually, if you look long enough, where it collects is at the other end, at veins, which are another part of the circulation. Once it reaches those veins, it's able to drain out of the brain along the outside of the veins. As the fluid sort of courses between those two, in along the arteries, through the tissue, out along the veins, that continuous flow sweeps along particles that are sitting in between the cells. Amyloid beta is a protein that is made and secreted from cells in your brain all the time. In Alzheimer's disease, one of the things that happens is amyloid beta builds up in the brain and clogs up the space in between the cells. And it's thought that that's what kills the neurons and causes the dementia that's the hallmark of Alzheimer's disease. So when we first found the system and found that it was clearing extracellular solutes, we said, well, what solutes might be of interest that might be being cleared by this? And when you think about extracellular solutes that the brain wants to get rid of and needs to get rid of, the first thing that comes to almost everyone's mind is amyloid beta. So that was pretty much the first thing we tried, was to find out whether amyloid beta that's between the cells is cleared along this pathway. One thing that could be happening in Alzheimer's disease is this pathway is failing. So if because you're aging, this pathway stops working properly, or because you suffer an injury or an infection at some point in your life, maybe this pathway stops working properly, and that ends up causing the deposition and the accumulation of amyloid. For treatment, it suggests that you could slow the process of amyloid deposition, perhaps by speeding the system up and sort of flushing the brain out and getting rid of the amyloid before it accumulates. And if you had, a brain that had a bunch of amyloid that had already accumulated in it, perhaps you might be able to flush that away or wear away those accumulations with, a higher rate of flow. So we may be able to try to modulate or change how this system functions to try to clear it more quickly.
So I hope you enjoyed that video. Here's a little deeper dive into it. This is a close-up of Professor Ilyich in the animation that my associate Tanveer made. This is a structure called the neurovascular unit. It's a close-up of the micro unit in the brain, explaining why this is so important. The blue are astrocytes or glial cells. Notice they have like little, what are called end feet. And if you can imagine this in 3 dimensions, these end feet like to snuggle up against each other. They also like to snuggle up against neurons. They also like to snuggle up against blood vessels of the vascular flow. And this is on the level of about 20 to 40 nanometers. So it's like like 25 million an inch. You have to think very, very micro. Now, this light yellow area is called the perivascular space. These are like the micro rivers in the brain. What happens when there's inflammation is these astrocytes swell up and get bigger, which means the channels get smaller. And then also, if you have less flow of cerebral spinal fluid, the river is moving less quickly. And what happens is that creates an opportunistic situation where if you were to put little black dots in here, like you saw in the illustration, that's where the amyloid plaque can form. And left untreated over time, this amyloid plaque basically destroys, in later Alzheimer's, the neurons, the vascular unit, the astrocytes, everything. It becomes non-functional. It's like a high degree of inflammation. And in a lot of my advanced courses, I talk even more about the mechanics of this. So that's the bad news. Now, the good news is, as the professor was hinting at, is if you had a way to speed up the flow of cerebral spinal fluid and wash these toxins out, it would be like if you have a dish you're washing and you have to scrub it really hard to get the dish clean, or if you're in a car wash, put the nozzle really close to get the specks out. That's what you're doing. And the question would be, how can one do that? Well, a theory comes to light. The formation of plaques and tangles could be triggered by inflammation in the brain. CSF function could increase using a still point, and then increased flow of CSF can help clear inflammation. It can help decrease formation of plaques and tangles and help the body clear plaques and tangles from the brain. So what does the still point technique do? It increases blood flow to the brain, flow of CSF, flexibility of the nervous system. It helps stabilize. This is something we've been teaching for decades. It helps with stress, lower blood pressure, helps with cerebral pulmonary congestions, metabolic waste, headaches, and migraines. It helps remove, and we found this with autistic kids on the spectrum as well, helps remove metallic toxins across the blood-brain barrier. So the results we've seen from some of our initial studies in 2008 is decreased agitation, ability to know one's position in time, space, and location, and having a sense of self, which is really tied, to memory. All right. So functioning recovery, it's a new concept in memory care. Instead of thinking that Alzheimer's is a death sentence where there's no hope, and basically things are downhill as we age, we're kind of like reversing that and saying, well, no, people actually could. Functioning recovery means finding the right combination of therapies to keep people stabilized so they don't get worse, maybe stop their progression, even getting better. So patients can get better, their quality of life can improve. We can design a program and create a team that helps each individual maintain the gains. And it's revolutionary because it suggests, again, the progression of this disease can be delayed, halted, or even reversed. And our 5-year goal, by the way, I'm on my second 5 years of this, is to significantly reduce the deaths from Alzheimer's worldwide. And what I mean by significant is even 20%. So if 500,000 people a year die of Alzheimer's, that's also tied to cardiac disease and respiratory, even if we could save 100,000 of those, that could be significant. All right, how you can participate, and we're getting to the end here. If you're new to CranioSacral Therapy, here's some options. You can take a 2-day virtual layperson class that I teach. It's called CranioSacral Therapy for Longevity, Applications for the Treatment of Alzheimer's Dementia, or CST-D. And you can contact me for this, and we'll share these links tomorrow, michaelm@bodyenergy.net, and join a waiting list. I'll probably have another one of these in September or so. And they're virtual, so you can learn, you can have partners and own to practice on. This is not just for therapists, but for lay people, so they can help support their loved ones at home, or for therapists that want to have a 2-day introduction. So that's one option. The next is for more professional training. You can contact the Upledger Institute at upledger.com and click on Find a Class and look for the 4-day craniosacral class in your area. By the way, for the massage therapist, this is 13 CEUs or educational units for the 2 days. And I think with Upledger, it's 24. Might be 28, but at least 24. And that's something you can find in your area where we teach, like say in Atlanta or New York or Chicago, all around the country, all around the world, actually, in 58 different countries, 60 different countries. As well, I have created, because of the demand, you can become a certified longevity specialist. And for that, you can take Cranial 1, which is a 4-day course, Cranial 2, a 4-day course, and some mono-emotional release. And then I have an advanced course called CranioSacral Therapy for Longevity, Reversal of the Aging Process. So that's a deeper dive into developing techniques for both people that have Alzheimer's and people that are well and healthy that want to stay that way. Then I have a 1-year training, which I'm training my first group of people right now to use your advanced CST skills in the 100 million plus senior population. And the certified longevity specialist will receive referrals from me for clients in the area. They're on my website, preventingalzheimers.com, and they're eligible to be compensated as lead therapist in my mini intensive programs. Now, as a client, if you have a client or someone in your family that you're concerned about, you can get a 1-hour session. You can contact me at michaelm@bodyenergy.net to find referrals for someone that I've trained a little more extensively in your area. You can contact me, and again, this will be on your website as referrals, for a 30-minute free evaluation to assess your client's need, condition, and treatment. And then I have something which is the keystone of my treatment. It's a 3-day mini intensive program where I have many therapists work on someone at the same time for 2 hours, 3 days in a row. I'm doing one in Southern California in the next couple of days. And it allows people, as we pioneered at the Upledger Institute for years, to come in and have expert people work on someone in a group setting and get into really the deeper dive of where somebody has had a problem and start to clear those up. So that's another option, and you can go to preventingalzheimers.com/mini-intensive for more of an explanation of that. And then also, what I have done to really get the word out to the larger world is I've created something called the Alzheimer's World Summit, where I interview 30 experts from around the world in all these different areas of expertise, whether it's neurology, whether it's home inspection, whether it's mold and toxins, whether it's music, whether it's people that are just inspirational speakers. And I will let you know as we're coming into October when to sign up for this free Alzheimer's 2024 World Summit. This is my 4th year of doing it, and it's really spread the word about craniosacral therapy throughout the world. And so as part of your email list, we'll alert you again about 3 weeks before we register. Okay, to register for this. So we're ready for questions and answer. Remarkably, I'm only 2 minutes over my my time. I'm going to stop sharing, and then we can take any questions you might have. So thank you for listening. I hope that was not too much, but this kind of gives you an idea as well. Oh, and I'm looking at some of the chats right now.
Well, thank you, Michael, very much. That was like a power-packed, informational edu talk.
Yeah.
And I thank you for that. let's address the chats and then
Yeah.
that have come in, and everyone
Yeah.
feel free to still chat questions or comments to Michael. Let's see. Michelle, I was able to see this on my mother's scan. She mentioned
Yeah.
that when it
Yeah.
showed the brain, healthy brain, and the Alzheimer's brain.
Yeah.
This difference in size.
And Michelle, a lot of times this happened with my sister-in-law too. It's like nobody could figure out what was going on with her. And finally went to Mayo Clinic in Scottsdale and they saw the scan. And even doctors that are not versed in this is so common in a sense. And Dr. Upledger noticed this 20, 25 years ago, that it looks like the brain is shrinking a bit. That's kind of normal, but it's not really, but there's less flow of cerebral spinal fluid. And so when you see that, that's what we call a clue in craniosacral therapy. We need to pump up the volume. So yeah, so that's, sometimes we can see it. So even doctors, that's our pathway to educate doctors. They understand the neurology of this. I'm just adding the piece of saying, oh, did you know there's less flow of cerebral spinal fluid? And did you know there's a non-invasive, safe way that won't hurt anything to increase that flow? So, yeah.
And Bill is asking, what kind of self-help can we do to increase the flow of craniosacral fluid?
The Upledger Institute, and I'm sure that Jackie that sends information will talk about this. We call it, we sell a device. It's about a $30 device called a still point inducer. And you can lie on it, and that helps induce a still point manually without even having a therapist. It's great to have somebody do it on you. And basically what I do in my 2-day layperson training is train people how to do this and some other simple techniques as well, so they can do it on their loved ones, so they have continuity between treatment. But that's one thing you can do at home, is just get a still point inducer. All right.
Okay, and Maria was asking, good question regarding how can someone apply care to enhance the craniosacral fluid? And again, does that get back to the still point
Yeah,
inducer?
it does. It
And
does.
would that also apply to the hands-on, seeing a
Yes.
therapist?
Yes. Yes. The still point is something that we have done for years, for decades. And I knew that when I started this journey, I knew the craniosacral already helped with closed-end injuries and headaches and migraines. And with my relatives, my stepsister and sister-in-law having dementia and dying of it, I thought, well, maybe craniosacral could help with this. So that's what got me into looking at our 2008 study where we went to nursing homes and did a still point every day for 6 weeks. And it took about 3 weeks, but then we started to notice results. Like we had one 100-year-old lady that was starting to speak in full sentences. People started to notice their caregivers. One lady started to be able to eat by herself. And the biggest single thing is, you may have heard of sundowners, is people's agitation lessened. That's a big thing for nursing homes to manage, right? So their agitation lessened. That's a first order effect. But then from there, we started to see more mental clarity. And so that's the kind of the continuity with these mini intensive programs. We just want to add to that to increase the pace, especially if somebody's had some symptoms that show there's been some aggravation over time.
Well, very good. There's a handful of thank yous and very informative.
Yeah.
And again, everyone, we still have a few minutes to ask Michael questions and comments. Now, Michael, I wanted to ask the World Summit.
Yes, it is red, by the way, Michelle. Michelle pointed inducer is red, yes.
What is this?
Somebody asked, is the still point inducer red? And I said, yeah, it's red.
Okay. And it can be
Yeah.
purchased through the Upledger Institute.
Yeah. Mm-hmm,
All right. Let's see. Michelle, again, I'm glad to hear you did this at the nursing home. Thank you for this
Yeah.
help. Thank you. Looking forward to meeting you in the future. And everyone, Iris had asked, if she came in late, if she'd be able to see the full recording. And yes, tomorrow you will receive a follow-up email, which will include Michael's recording. It will include contact information for the Upledger Institute and Michael, and it will include the handout, gosh, I almost forgot. I went out of order. So yes, and to those of you who haven't joined in EduTalks previously, on biotone.com, under the EduTalk tab, you can RSVP to upcoming EduTalks. You can view over 4 years of EduTalks in the archive library. And there is also the EduTalk author series that is posted online. So just additional resources, but watch your inbox. And if you don't see it by the end of the day, check your spam folder for my email and follow-up. Additionally, over the next few days or a week, Upledger Institute will send an email with special offer and information to all that attended. So 2 things to keep your eye on in your inbox. And now I wanted to go back to some questions I had. The World Summit in October, is that virtual or is that in a physical location?
No, that's virtual. So I'm interviewing people as we speak, some really sharp people. And I archive those interviews and then they're released over a 5-day period. So you can come in and view, the 9th, 10th, 11th, like that every day. About 5 or 6 different lectures. Yeah.
Oh, and that's great. And do share that information with me as well. Your 4-day class, most, from what I understand with Upledger Institute, is you take a basic like 101 class.
Right.
People would need to
Right.
do that through the Institute in
Yeah.
order to take the 4-day class.
Well, yeah, it's like 3 levels. There's cranial 1, cranial 2, and somato motion release. Then from there, they can branch off if they want, especially in pediatrics or longevity or the brain speaks or the immune system. And from there, you can branch off into any number of things. But yeah, that's the basis of it, that core. Yeah.
And further specialize.
Yeah.
And, oh, okay. Oh, I kind of wondered at the beginning when we were getting into this and you were giving the different elements of causes that could contribute to Alzheimer's and dementia. And one of them was trauma. I wondered about concussions. How can
Oh, yeah.
So head injury.
We have a whole
okay.
We have a whole class Marianne Cisco has developed, and then also allied in the visceral manipulation area, Gail Wetzler, on concussions itself, because that's been such a whole area, not just with NFL sports, which is kind of where we started, but now it's rippled down even into non-professional. Think about soccer, think about all these areas where there's trauma, and that causes the brain a little bit like a shaken baby, to be inflamed.
Oh, yes.
And so there's a whole area of study and focus just on that. And for anyone of you that have worked with anyone that's had whiplash, car accidents, I mean, that's unfortunately more common than one would think and can be quite debilitating. So in the craniosacral world, very often, not always, but very, very often, you can clear up a lot of trauma, even for people that have been non-functional, to help clear that up. I can tell you many, many stories about that, but it all kind of started with the people that attract all the money, the football players, but then it's rippled down to non-athlete. And, that's why even protocols now you see in NFL, they'll have a timeout after a, sudden incident on the field. That didn't exist before. So that's a whole area. If you see that movie Concussion that Will Smith was in, there's a Dr. Vincent Amalu that he plays. I'm kind of like, not to make an analogy, but a little bit like this Kenyan doctor, Dr. Vincent Amalu. And I'm trying to do for Alzheimer's dementia what he did for concussions, because it's so prevalent. But we can help a lot of people. So that's just one whole factor. And I think too, I want to kind of give people an idea of there's a career pathway here that, especially in the younger generation where we want to pass on this knowledge. That's what I'm really wanting to do, that you can become specialized in this area and you're going to be servicing a growing area where there's a need. Everything from basic ideas and basic therapy to something much more advanced. And there's a lot of people that are keen on doing that. So we've kind of mapped out a whole pathway for people to, if they'd like, to participate at any level and take advantage of this accumulation of information.
Very good. I wanted to address Stephanie's question. Michael, do you know when you will have, and this I don't understand what it is, CSL RAP 2025 in the States?
That's my advanced class.
Okay.
So what I would have Stephanie is email me at michaelm@bodyenergy.net and ask, because I'm creating it as we speak. So it's June already, but I'm thinking about 2025, and I'll probably make a date. I may teach it, Stephanie, virtually. I may do a hybrid where I have some people like in Chicago come in person, some people virtually. But I just did one a couple of months ago virtually. I was able to reach people all over the world. So for sure, I don't have that date, but email me and I'll put you on my mailing list, or you'll be on my mailing list, and I'll let you know when we have that. Yeah.
And again, in the follow-up email that you'll receive tomorrow, Michael's email will be in there in the contact information, so that if you didn't jot it down already, it will be coming tomorrow. And on the Upledger website, and I'm not remembering it, there is a tab that says Find a Therapist.
Yes.
So anyone in seeking a therapist for themselves or others could find a therapist for craniosacral therapy.
Yeah, and when you see the tab, the more dots they have after the name, the more training. What I'm doing to supplement that on my own website is to say, yeah, people that have had training in longevity curriculum, even a more specialized, can do that. So I'm creating like a specialization, as we have for pediatrics, within that. Oh, I almost forgot. You mentioned authors. I wrote a book. I always forget to mention this. I wrote a book several years ago called Prevent Alzheimer's in Just 10 Minutes a Day. So you'll probably see on the Upledger website a share about how to get that too, if you're interested.
Well, let's talk about doing an EduTalk author series for you on the book. And
Sure.
10 minutes a day definitely sounds possible, doesn't it?
Yep.
And
Yep.
there is just so much information presented. When we started the presentation tonight, I thought inflammation is the root of all evil. And so it just seems to be in every EduTalk almost that we do. So that is something very interesting to look into. And when you counsel with someone or treat someone, are you also asking them about their diet, or does that come into it?
Yeah, I talk about it in my book, and there's so many different diets. That's a whole can of worms. So I'm kind of like live and let live, but I kind of gently suggest, hey, the less inflammatory your diet is, like a paleo diet. Now I've been doing even a more specialized diet. That will help, because sugar in high concentration is toxic. So what you have to do with cranial, I was just talking to a chief science officer of a company that does a lot of this first. I kind of say craniosacral therapy is like the gateway drug. Like, people get craniosacral and they see the effect fairly immediately. And from that, then they get an idea, oh, maybe I could do a little bit more with diet. And I just interviewed someone today who's a dancer, a very delightful lady in Canada. And she has a way of getting people, both the caregivers and the carees, together as a group and get them dancing. So they get used to touch, they get used to mobilization, and it's kind of fun. And the good news about that is that the caregivers, it's a lot easier for them to have empathy and understand that maybe the treatment will work with them as well. Because we want both groups, the caregivers and the carees, so to speak, to be on the same page. That increases the likelihood that they'll follow the program and actually have some positive input from that. So there's ways that we're defining to reach people. We're finding to reach people more effectively. So yeah.
Well, wonderful. Michelle is asking a message from Healing Hands. If I understand, moving, and I'm thinking it's craniosacral fluid, pre or post, can help with symptoms. And
one of the overviews of craniosacral therapy is that, in general, as a technique, this is something Dr. Upledger really pioneered, is that we're not just treating symptoms, we're going to the core. And because we go to the core of cerebral spinal fluid and the way that the body processes things, then the symptomatology starts to decrease. So, but yeah, I mean, yeah, you're on the right track. Absolutely, Michelle, is that moving cerebral spinal fluid can help pre or post. You know, what we like to do is help with prevention, as we say, avoid the danger that has not yet come. And a lot of people are concerned about Alzheimer's that are older, but we can train them with a regular practice. So you can have clients that they come monthly. That's their treat to get craniosacral therapy. And, you know, you can kind of get, if they're taking care of themselves anyway, prevent any further problems from addressing. If they're more at risk, you might need more treatment, which is what my many intensive programs do. So prevention's important. Yeah. Yeah.
Well, I hate to cut it short, but we'll need to.
Yeah.
I'd like to mention our upcoming EduTalks. And please join us. Watch your inbox for invitations. July 9th. Oh, I feel like I have so much more to ask you, but July 9th, Anita Shannon will present on ACE cupping therapies for surgical prep and recovery. Then on July 16th, for our EduTalk Diabetes series, we'll have Michael Shea presenting causes and care of type 2 diabetes. And on July 23rd, we'll have Brian Traskus present trauma-informed practice, an evidence-based approach to inclusive, compassionate, and holistic care. And I met Brian at the AMTA National Expo last summer, so this will be a great talk that he'll be presenting as well. You mentioned Marianne Cisco. She presented an EduTalk for us, which can be found in the EduTalk Archive Library on the EduTalk tab on biotone.com. And thank you everyone for attending. Michael, thank you for sharing wonderful information. I hope to have you back sometime. And everyone, be safe and be well, and join us again. Take care. Watch your inbox or your spam for follow-up. Thank you all.
My pleasure.
Okay.
Thank you.
Thank you.